Welcome to Cardio Radio, a podcast of the Ohio Cardiovascular and Diabetes Health Collaborative, also known as Cardio. This is Dr. Michael Constant from the Case Western Reserve University School of Medicine, and I serve as the principal investigator for Cardio, a statewide network of Ohio's 7 medical schools. Cardio is funded by the Ohio Department of Medicaid and shares best practices to improve cardiovascular health, diabetes outcomes, and to eliminate health disparities in Ohio's Medicaid population. The opinions and recommendations in this podcast are those of the presenters and not those of Cardio and its sponsors, and are not intended to be a substitute for medical advice. I hope you enjoyed today's podcast.
Hello, I am Dr. Melissa Thomas, Assistant Professor of Primary Care at Ohio University Heritage College of Osteopathic Medicine. I'm a certified community health worker and a member of Cardio's Team Best Practices. In this podcast, we'll discuss the role of community health workers in healthcare settings and share their potential impact in reducing health disparities and influencing cardiovascular disease outcomes. With me today are Dr. Joan Thoman and Ms. Milu Nguyen. Dr. Joan Thoman is an associate professor at Cleveland State University School of Nursing and the director of their community health worker program. Ms. Milu Nguyen is a public health nurse for the Delaware Public Health District in Ohio and the clinical program coordinator at the Ohio State University College of Nursing, where she coordinates the community health worker training program. Thank you both for being here today.
Thank you for having us.
Yes, thank you. I'm excited to be here.
Well, what a privilege it is to have you both here. I know about your programs and the great training that you provide. I want to ask you some questions that are specifically talking about the role of community health workers, or CHWs, as we often say. Milu, can you shed some light on what CHWs do and the scope of their work?
Yes, absolutely. So community health workers are individuals who either live in the community or have shared experiences with the community that they serve. They serve as liaisons for the community and the healthcare setting. So activities included educating, empowering patients on prevention, screening, and treatment of chronic conditions. They offer clinical support, including appointment scheduling, making travel arrangements, and helping with childcare needs. They help with care coordination and patient advocacy. This would include financial aid application assistance, patient navigation to attend appointments, provide guidance on where to receive care. They develop relationships of trust to bridge the cultural and linguistic gap that includes identifying with the communities being served, speaking the same language, and recognizing the traditions and customs of individuals. Many serve in local health departments, doctors' offices, and hospital systems.
Thanks, Milu. That's a great overview of who CHWs are and what they do. Joan, can you describe how someone becomes a community health worker? What's the training and certification process?
Sure. To become a community health worker, you must complete 100 hours of classroom training at one of 15 approved community health worker training programs, along with 130 hours of field or service work in the community. Community could include outpatient departments or hospitals. The certification process is regulated by the Ohio Board of Nursing, which verifies licensure and continuing education requirements every 2 years. There are 15 contact hours required every 2 years, 2 contact hours required a community health worker in the law, community health worker in the professional boundaries, and this happens in odd years. The training program covers basic core curricular areas mandated by the Ohio Board of Nursing, which are healthcare, basic healthcare, community resources, communication skills, and individual and community advocacy skills, health education, service skills and responsibilities, and newly added this year, social drivers of health for working with communities.
It's good to know that there are so many opportunities around the state to access these training programs.
Absolutely. You can find the latest on training program locations on the Ohio Board of Nursing website, which will be posted with the episode notes.
Now, there are currently 1,200 community health workers certified in Ohio, and this number is steadily growing. Could you share the evidence demonstrating the impact CHWs have on community health? Milu, could you start?
Sure. So community health workers play such a crucial role in enhancing community health outcomes, as evidenced by numerous peer-reviewed studies. Key findings include that CHWs contribute to increased healthcare access in underserved areas, particularly benefiting maternal and child health. They successfully manage chronic diseases, reduce health disparities, empower communities, and demonstrate cost effectiveness, especially in resource-limited settings. The impact of CHWs vary on context, training, and health issues, emphasizing the importance of well-supported CHWs in community health improvement.
Yes, and I will add to that. In fact, studies have shown the benefits of community health workers in hypertension control. A systematic literature review from 2022 noted that community health worker interventions produce positive results in decreasing blood pressure, enhancing health care accessibility, encouraging treatment compliance, and reducing the likelihood of cardiovascular disease.
Well, following up on that, Joan, what roles do community health workers have in reducing health disparities in underserved and marginalized communities with cardiovascular disease here in Ohio?
I think community health workers play the role of the liaison, that individual who's there to help connect community members. Community health workers get the resources that communities need by really seeing the other barriers that keep them from good cardiovascular health. Community health workers are able to know if the needs are education, health literacy, and can help address questions that may not even be shared in the doctor's office. For example, do you understand your diagnosis? Hypertension, they might not understand. You have high blood pressure, they'll understand that. Do you understand what you need to do to stay healthy? What are the social needs? Do you have transportation barriers? Do you have barriers getting to a pharmacy to get your prescription medications? Do you need help getting signed up for insurance? Do you need to realize how to utilize that insurance? And community health workers address all these little things that may come easy to us as healthcare providers, as clinicians, but may be quite difficult for those with limited resources.
Yeah, those are some great examples of how community health workers can help fill in the gaps of factors impacting health. Now that we know a little more about who CHWs are and what they do, how can one expand the integration of CHWs in hospitals, clinics, and other community-based organizations for cardiovascular disease in Ohio? Milu, can you address that?
Yes, CHWs are most effective when they are fully integrated with multidisciplinary care teams. This integration encompasses obtaining access to patients' health records, participating in case review meetings and rounds, and actively contributing to the development of care plans. I have a few examples of adopting successful practices from other states that could benefit Ohio's healthcare and primary care programs through the use of community health workers. For example, Spectrum Health in Grand Rapids, Michigan, accomplishes this by using CHWs to complement the skills of nurses as part of their core health program that aims to improve population health. CHWs play a crucial role in medication management by collaborating with nurses and primary care physicians. They reach out to local pharmacies to find those that offer medication delivery services and the lowest possible copays for patients. This not only ensures that the patients receive their medication conveniently, but also reduces their financial burden, thereby promoting the ability to follow prescribed guidelines. Furthermore, CHWs can be instrumental in addressing broader social determinants of health. For instance, they can identify patients who are struggling to manage chronic conditions like diabetes due to challenging living conditions, such as those residing in overcrowded apartments. By understanding these underlying issues, CHWs can connect patients with appropriate resources and support services such as housing assistance program, which can alleviate these stressors and improve their overall health outcomes. Implementing such strategies in Ohio could lead to more comprehensive and effective healthcare delivery, ultimately enhancing the well-being of its residents.
Thanks, Milu. Now let's dig a little deeper. Joan, what distinct roles do community health workers play in the healthcare system that set them apart from other healthcare professionals like nurses and social workers?
Community health workers provide culturally appropriate and accessible health education and information on cardiovascular disease and diabetes using a variety of educational resources, including technology. Advocacy is a huge component of the role of the community health worker to ensure that the clients get services that they need to include obtaining and paying for medications, arranging for delivery or transportation to the pharmacy to pick up medications. Community health workers are taught how to measure and monitor blood pressure and blood glucose levels. These are required curricular areas for community health workers via the Ohio Board of Nursing. Community health workers can help community clients obtain home self-monitoring blood pressure and blood glucose devices. Community health workers are taught normal ranges for blood pressure and blood glucose and can educate community clients when to call their healthcare provider. At community events, community health workers can do health screenings, for blood pressure and blood glucose, give the normal ranges, and refer a community client to a health provider for out-of-range readings, or have often instructed clients to go to the emergency room. Community health workers are instrumental in educating clients and their families on the importance of making lifestyle changes, taking medications, and following the treatment plan as advised by the multidisciplinary team. And community health workers can teach classes on chronic disease management. Community health workers also bring the lived experience of their communities and are trusted members in the healthcare system as they are boots on the ground. Community health workers can strengthen their community understanding and acceptance of medical care. This is why it's important that community health workers be included as members of healthcare teams to help eliminate racial and ethnic disparities in healthcare. In addition, community health workers can serve as resources in educating the multidisciplinary team of healthcare providers about the lived experiences of the communities that they service.
I feel it's important to highlight the unique perspective that CHWs bring to a multidisciplinary team. CHWs bring that lived life experience that enables them to connect with the population that they're targeting or working with. Most CHWs remain in the community that they are most familiar with or grew up in. They're that trusted member of that community. They have experienced the challenges that the client is facing and or have had to find and use the very resources that they're referring their clients to.
Wow, I'm definitely picking up those common themes of lived experience and trust in both of your examples. Well, Milu, based on your own experiences, can you provide an example of how CHWs contribute uniquely to addressing cardiovascular health in patients?
Sure. So community health workers can help an individual overcome not only language barriers, but also health literacy barriers. Only about 10% of the population are completely health literate. That leaves about 90% of the population who are not completely health literate. CHWs can be the support individual for someone with either language barriers or even comprehension barriers. So, for example, our program placed a Nepali community health worker at a federally qualified healthcare center. This individual helped educate and outreach to Nepali patients that came to the center. The Nepali CHW worked with a family with a patriarch that was having issues with high blood pressure. The patient was on blood pressure medication, but was still having issues with high blood pressure that led to headaches, some dizziness, vertigo as a result. The patient had access to medication. His son was picking them up for him and dropping them off for his father to take. After further discussion with the client shared with the CHW that some pill bottles were much harder to open than others. The arthritis in his hand had prevented him from pushing down and twisting on the medication cap. So the patient was cutting his current blood pressure medication in half to extend them since he was not able to open his new bottle of blood pressure medication. The CHW assisted the client with calling the pharmacy and putting a note on their file for senior-friendly caps for their medication. As a result of this, the patient was able to take his blood pressure medication consistently and at the proper dosing, resulting in the patient's blood pressure dropping. It's simple things like this that a CHW brings such insight in that can really help with the population that they're serving.
Wow, such a great example of just connecting with a patient and addressing a common issue among older patients with chronic health conditions. Joan, I'm sure you have an example or two as well.
I sure do. Community health workers participate in a foot clinic in one of our Cleveland's East Side neighborhoods where there is a known high prevalence of hypertension and diabetes. And these clinics are held monthly at a local church social hall. There is a podiatrist who tends the clinics and examines the feet of the clients who come to the site. And community health workers wash feet, teach about foot care, and also take blood pressure and blood glucose readings. Several out-of-range levels are often found, and healthcare providers are recommended to community clients. Community health workers often find that the community client is out of medication and has missed appointments. And follow-up appointments are made on the spot with assessment of transportation and arrangements made if needed.
Wow, what a credible resource of support at these clinics. It's great to see how CHWs can be integrated into existing programs to provide an extra layer of screening for cardiovascular disease.
That's right. Community health workers not only can help patients in healthcare clinics and community programs, but they can also help save lives much closer to home. During the pandemic, while teaching our novice community health worker students how to do vital signs, we did not have access to our simulation labs. So the community health worker program arranged an off-site location. We purchased blood pressure cuffs and stethoscopes, and several of us volunteered to be standardized patients, including me. Several community health worker students kept picking up high blood pressure readings on me. I told the students to keep practicing, but after the fifth student, I had the other instructor take my blood pressure, which was 170/100. To be sure, we took it 3 times and the reading remained elevated. This led to an appointment with the primary care physician, who also obtained high readings and a referral for the cardiac CT scan, which indicated the 96th percentile of women my age for a heart attack or stroke in the next 5 years.
Wow. Wow.
Yeah, the physician suggested a referral to the cardiologist, who also obtained high blood pressure readings of 200/100. In fact, I told her she had the wrong chart, but it was me. The cardiologist did further diagnostics, which included 24 hours of blood pressure monitoring and a stress test. Both were not passed. I failed beautifully, just failed. The diagnosis was primary hypertension based on the 24-hour blood pressure testing, 2 blocked coronary arteries at 40% based on the cardiac catheterization, and subsequently the diagnosis of 2 arrhythmias, which were treated with ablation. This also involved a multidisciplinary approach with dietitians, pharmacists, and an exercise physiologist. Now 30 pounds lighter, a total change in my food plan, a walking regime and medications, the condition is now stable. This started, however, with community health workers taking blood pressure and finding high readings in a community setting. Otherwise, I was walking around not even knowing I had any of these issues. Community health workers are a crucial part of this team for prevention of cardiovascular disease and hypertension.
Wow, Joan, you are a walking, just living example of how important CHW's work are.
Thank you.
Wow, Joan, that's incredible. I'm so thankful you agreed to volunteer as a patient that day. That's great news on improving your health. I want to thank you both for sharing such valuable insights on the role of community health workers in addressing cardiovascular disease. Well, before we wrap up, do you have any closing thoughts or messages you'd like to leave with our listeners?
Absolutely. Community health workers serve as the frontline workers who operate directly within local communities. They bridge the gap between healthcare providers and the community members that they serve. These individuals are often well acquainted with the community's unique needs, cultural nuances, and social determinants of health.
I couldn't agree more. Community health workers play a pivotal role in care coordination. They act as crucial members of care teams in both clinical and non-clinical settings. Their involvement enhances communication and collaboration among healthcare professionals, ensuring that patients receive comprehensive and well-coordinated care. In addition to supporting clinical efforts, community health workers contribute valuable insights into the social and environmental factors that may impact an individual's health.
Yes, very well said, Joan. CHWs are definitely instrumental in promoting equal access to healthcare within a community. By working closely with individuals, especially those in underserved or marginalized populations, CHWs help break down the barriers to care. They serve as advocates, educators, and navigators, empowering citizens to overcome obstacles and access the healthcare services that they need. This proactive approach contributes to reducing health disparities and promoting health equity across diverse populations.
Well, thank you both for joining us today and sharing your expertise on the crucial role of community health workers. Before we wrap up, I'd like to extend my gratitude to our esteemed guests. Your insights have been incredibly enlightening and provide a deeper understanding of the impact community health workers have on community health.
It's been a pleasure to be here and discuss a topic so close to my heart. Community health workers truly are the unsung heroes in healthcare, and I'm grateful for the opportunity to shed light on their essential work.
Yes, thank you for having us, Melissa. I hope our discussion inspires listeners to appreciate the invaluable contributions of community health workers and recognize the positive changes that they bring to the communities that they serve.
And a special thank you to you, our listeners, for tuning in to Cardio Radio.
This concludes today's podcast. Be sure to visit cardio.org to learn more about the Ohio Cardiovascular and Diabetes Health Collaborative.